The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease.
Those were the words of Thomas Edison, a man of amazing vision. Just as he could look into the future and visualize the technological needs of a new society, so he could also foresee the health needs of the 21st century. This is Chuck Ford with Insight, the program that gives you a look at the human body and the modern approach to health. From Hippocrates, the father of medicine, and Galen, the prince of physicians, to the 19th century bone setters of the British Isles, many great men throughout history have recognized the importance of the spine and nervous system as they relate to the health of the individual. The wisdom of this concept has become even more apparent as our society has become more and more dependent on drugs and surgery for treatment of health problems. Our cover story, Chiropractic, Health Without Drugs. We hear so much nowadays about the rampant use of hard drugs, but often overlooked is the quick fix mentality that causes drugs and medications to be used without serious regard to side effects. Even surgery is accepted by many people without questions asked. Doctors of chiropractic have long been critical of an attempt to find a chemical cure for every ailment known to mankind. They have long been proponents of the power of the body to heal itself, and they have long championed the holistic concept of health care. At one time, this approach to health was not taken seriously by some, but today, informed health authorities of all disciplines recognize the body's role in maintaining health, and the effectiveness of chiropractic's natural procedure is well documented. Let me tell you a little about chiropractic. Chiropractic is the second largest of the three healthcare providers in the U.S. It is a healing science based on the premise that good health depends in part upon a nervous system that is functioning normally. Body structures, such as organs, tissues, and cells, are controlled by the impulses carried through nerves. When nerve impulses travel uninterrupted, these body structures are able to function normally. However, when there is an interference, that is, too much or not enough nerve supply, the organs, tissues, or cells cannot function properly, and malfunction may begin, predisposing the body to a state of disease. Chiropractic recognizes that the body has an inborn ability to try to maintain a state of good health. This natural process is working all the time, even though you are not aware of it. For example, think about what you had for supper last night. You didn't have to tell your body to digest it, did you? You didn't have to tell your heart how many times to beat or your lungs when to breathe. Of course not. These are natural processes. In the same way, the body has the ability to keep you well without your conscious effort, provided there is no interference. But sometimes there is interference, structural interference. It may come from an accident or something not even remembered, such as straining, bending, or lifting, or just doing what you normally do at work or play. It is an interference caused by a malfunctioning spinal joint that pinches a nerve leading from the spine. It can cause excruciating back pains or headaches. But worse, it can also interfere with the nerve impulses, thereby affecting other parts of the body. Chiropractic's health procedure is directed toward reducing nerve interference in order to restore normal functions, which is the basis for health. Chiropractic views pain or discomfort as a symptom and not a cause. In effect, it is your body's way of talking to you and saying something's wrong. Most people fool themselves into believing that the problem always exists at the point of discomfort. So if your head hurts, you think the problem is your head. If your leg hurts, you think you twisted it. If you have a stomach ache, you stop eating foods which you think cause the distress. And unfortunately, we have been preconditioned by our impatient society to believe that any time a symptom appears which makes us uncomfortable, we need simply pop this pill or swallow that liquid, and all will be well. Drugs and medications have become so commonplace that we do not question if we should take them, but rather which ones and what dosage. In reality, the point of the body at which the pain or discomfort appears doesn't necessarily give a clue to its cause, and often we are merely masking the symptoms rather than correcting the cause of the malfunction when we depend on medications for relief. This is like turning off the fire alarm instead of putting out the fire. Chiropractic looks for the source of the problem, which often is in the spine. The spine houses nerves that serve every part of the body, controlling function and signaling pain. To fully understand the complexity of the spinal column and how it relates to your anatomy, we have a special report from our health correspondent.
Hello, I'm Dr. Larry Stewart, and this is a model of your spinal column, otherwise known as the vertebral column. It is comprised of a series of movable bones running down from the center of your skull down through the center of your hips. Now, there are 7 cervical, or neck vertebrae, 12 dorsal, or mid-back vertebrae, and 5 lumbar, or low back vertebrae. The vertebrae are stacked up like building blocks, and they're separated by fibrocartilages, or discs, right here. Now, these discs cushion shock. They reduce friction and allow movement. Within the spine, there are 31 pairs of spinal nerves. Let me show you. The spinal nerves travel down the spine from the brain through a series of openings between the vertebrae. Now, the nerves leave the spine and form a complicated network which reaches every organ and living tissue in your body. Accidents, falls, uneven stress, tension, overexertion, or any other factor which may cause a minor displacement or derangement of one or more of these vertebrae can cause irritation to spinal nerve roots. Chiropractic teaches that nerve pressure or nerve irritation can cause a disturbance of delicate body functions, resulting in an increased susceptibility to disease processes. By alleviating the irritation to spinal nerves, the doctor of chiropractic seeks to cause your body to operate more efficiently and more comfortably. That's why it's so important to have spinal adjustments on a regular basis. And that's the inside story on your spine. Chuck?
Thank you, Larry. Most people know that chiropractors treat orthopedic-type cases such as backaches, disc pains, sciatic problems, and whiplash. But unfortunately, many are unaware that other functional disorders, such as those that involve organs and internal glands of the body, may also respond favorably to chiropractic procedure. The chiropractic approach to treating health problems is to locate the area of the body which is not receiving a proper nerve supply and take corrective action through spinal manipulation, which is known as an adjustment, and other procedures. Chiropractic's scientific approach has restored good health to millions of people, many times after other methods have failed. And what I like about it, it is a conservative procedure not using drugs or surgery, which makes it safe, too. Now, before I go any further, to answer a question that is often asked, this does not imply that drugs or surgery should never be recommended. There may be times when your body is not able to overcome a condition that has overwhelmed its defense mechanisms. When this occurs, your doctor of chiropractic will refer you to the appropriate type of health practitioner for your particular problem. Your doctor's training enables him to advise you in these and other health matters. That is why so many families depend on their doctor of chiropractic as their family health advisor. Now, let's talk about procedure. All doctors use a standard procedure of examination to diagnose a patient's condition in order to arrive at a plan of treatment, and the doctor of chiropractic is no exception. First of all, the doctor of chiropractic takes a patient history. This identifies the problem with which you are chiefly concerned and profiles your background, which might give a clue to its cause. You might be asked about your family history, dietary habits, other chiropractic, osteopathic, or medical treatment you may have had, details about your job, and other questions, each designed to help determine the nature of your illness. In addition to the consultation and case history, a physical examination, including laboratory analysis and X-ray examination, will be performed in accordance with your doctor's clinical judgment. But in addition, a careful spinal examination and analysis will be performed to detect any structural imbalances which may affect your condition. You may not see any connection between a fall you suffered as a child or some other seemingly unrelated item and your present illness. But all these factors will be significant to your doctor of chiropractic when he evaluates your total health profile. You must remember that your body is constantly changing, from childhood to adolescence to maturity, and on into the various stages of age. All the processes are dependent on maintaining the integrity of the structural being. The slightest deviation may not be noticeable when it occurs, but can grow more serious with time, affecting various organs and body processes before you finally recognize the symptoms of a health problem. Your spinal examination and other findings, when analyzed through the skill and experience of your chiropractor, greatly aids in the identification of the causes of your condition. Based upon this, treatment can begin. Doctors of chiropractic spend countless hours learning palpation, which is the art of examining by touch, and refining spinal examining procedures in order to administer a specific spinal adjustment. An adjustment, as doctors of chiropractic use the term, means manipulation of vertebrae which are out of proper alignment or do not move properly within their normal range of motion. The adjustment is usually given by hand. It consists of placing the patient on a specially designed adjusting table and then applying pressure using specialized techniques to specific areas of the spine. The purpose is to relieve pressure and irritability on sensitive nerves and correct abnormal structural relationships. Adjustments are precise maneuvers which require considerable skill and dexterity, and techniques utilized require special knowledge of the anatomy. A question sometimes asked about adjustments is there a reaction that I have to worry about? The answer is no. In the course of being treated for spinal derangements, the feeling may vary from a great sense of well-being to mild soreness, depending on the severity of the problem and the patient's sensitivity. But these are natural tissue responses. You know, most people think of chiropractic care as being utilized by adults, but they overlook the fact that children abuse their bodies even more than adults. In fact, many health authorities recommend a spinal examination before the child reaches 6 months of age, and every 6 months thereafter until the child stops growing. It is also suggested that the mother have a chiropractic examination soon after giving birth with necessary procedure to correct any spinal deviations which may have occurred as the result of carrying and delivery. Parents should be as concerned about having their children's spines checked for nerve interference as they are about having their children's teeth checked for cavities. Proper spinal care is essential to a child's health. Now let's look at the older side of the spectrum. Why the need for chiropractic care for senior citizens? For that report, let's go to our special correspondent.
Our cover story today is on aging. Aging is a natural process which subjects the body to special structural problems. Among the most common are degenerative joint disease, such as arthritis. Now, many of the ailments are related to the spine and extremities, and pain and stiffness are two of the most frequent complaints. This is what the normal cervical spine, which is the spinal neck area, looks like. And this is what the same area looks like when early degenerative changes set in. There are changes in the facet joints and nerve irritation. Some common symptoms include neck pain, headaches, grating sensation when turning the head and neck, and pain in the shoulder, arm, or hand. As the degenerative changes progress, spur formations develop on the vertebrae, and more nerve root irritation takes place. Symptoms may include numbness and tingling in the arm, hand, or fingers, neck stiffness, severe limitation of movement, dizziness, lack of muscle coordination, and weak grip. As osteoarthritis becomes more severe, significant spur formations take place, along with more disc degeneration. There is limitation of motion of the entire cervical spine, and there is extreme nerve root irritation. All the symptoms may increase and become more painful. Comparing the normal spine with the osteoarthritic spine, you can easily see the deterioration, and thus the problem. Now, note the spurs and the thinning of the discs, which normally would act as shock absorbers. Exactly what happens when a person ages? Well, the muscles which help to maintain the spine in its normal alignment begin to lose the muscle tone needed to maintain balance. Also, the elastic discs which separate the vertebrae of the spine lose much of their ability to stretch and to move. Now, when this occurs, the spinal vertebrae have a greater tendency to slip or move erratically, affecting the spinal nerves which lead to the vital parts of the body. Chronic conditions such as arthritis, circulatory disorders, constipation, and stiffness of various joints, which are associated with the process of aging, can be greatly alleviated with regular spinal adjustments. This contributes to the older person's ability to move around more comfortably, which is all important to the senior citizen. And really, it's the difference between keeping active and in the mainstream of life and being dependent. It's also important to add that a healthcare procedure that does not utilize drugs, which, by the way, chiropractic does not, allows the older person to be more mentally alert. It does not subject him or her to the dangers of habit-forming medications and their mind-dulling side effects. It's safer. This is Dr. Larry Stewart reporting for Insight on Health.
Thanks, Larry, for an interesting report. We've talked a great deal about health problems and how chiropractic relieves pain and suffering. What we haven't covered in this program so far is the use of chiropractic to enable people to perform better, stay healthy longer, and gain more satisfaction out of life. For example, numerous athletes depend on chiropractic maintenance to make them play better, run faster, or generally avoid injury. This is not hard to understand when one realizes that the health concept upon which chiropractic is based is to bring the body into balance so that it can function most efficiently. Once achieved, the body is not only healthier, it is able to perform better. That's why so many people practice preventive care and follow a maintenance program with periodic visits to their chiropractor. Well, I'm afraid we're running out of time, but what I have tried to bring out here is that our health is our most priceless possession and certainly deserves more serious consideration than most of us give it. If people will just realize that health cannot be packaged in a bottle and a pill cannot erase the source of a health problem, they will be ahead of the game. Of course, no one health discipline has all the answers to the complex problems of disease and disability, and often it takes the services of more than one doctor to achieve results. But chiropractic represents a highly effective and safe form of treatment, and it should be used first, before potentially harmful drugs or surgery are tried. This is Chuck Ford with Insight on Health.